Hi there. Welcome to Sound Family Medicine's open enrollment meeting this year. As you can tell, we're doing it remote due to COVID, but we are hosting meetings next week to ensure that you can get all of your questions answered. And so those are occurring next week on Monday, Tuesday, and Wednesday. And if you're unsure of those times, please reach out to Kevin or Donna and they can let you know and make sure that you can attend one of those sessions. If you're unable to attend one of those sessions, you're welcome to reach out to us directly. My name is Megan Narens, and I'm with the Debt Benefits and is Sound Family Medicine's advisor with regard to their employee benefit program. So we're just going to quickly review the agenda. So we're going to talk about what open enrollment is, who's eligible to participate, the changes that are going into effect April 1st. We'll, of course, review the benefit plans. And then included in the email you'll receive with this video are the SBCs, which will go into a few more details as it pertains to the program. Talk about the costs, talk about member advocacy, as that's going to be a big component of the medical program starting April 1st. What do you need to do to sign up? And then it says questions and answers, but again, that'll occur next week, but you're welcome to reach out to us directly. So open enrollment, this is your annual opportunity to make changes to your benefits, enroll for the first time. So when you enroll, these benefits will take effect April 1st, and they will be in effect until March 31st of 2022. The only way that you're able to make changes throughout the year is if you experience a qualifying event, a marriage, a divorce, birth or adoption of a new child, potentially your spouse or child loses or gains access through another health program, become a United States citizen, or there's a few other special enrollment rights under HIPAA. But this is your time to make changes to your benefits to best fit you and your family's needs for medical, dental, vision coverage. So if you are an employee at Sound Family Medicine and you're working 30 or more hours per week, you're going to be eligible the first of the month following or coinciding with your date of hire. So the eligible dependents that are able to participate in the program are your spouse, legally married same-sex couples, or your domestic partner, children up to age 26, regardless of marital or student status, and then potentially any unmarried children of any age who are incapable of supporting themselves due to a disability. So what's changing April 1st? There's a few things which you've probably heard already. We've been trying to communicate as best we can with employees early this year because there's a big change with regard to the medical program. So we'll be rolling out the Sound plan, which is a community-owned health plan. And there are going to be 2 healthcare offerings this year versus the 3 offerings last year. And we'll go into those in a little bit more detail. One important distinction to know is that deductibles will start on April 1st, and deductibles, coinsurance, and out-of-pocket maximums, they will begin April 1st and run through March 31st of next year. Previously, we operated on a calendar year deductible. So even though the plan renewed in April, the deductible would restart along with the out-of-pocket maximum on January 1st. So that's a decent change that you want to be aware of. Member advocacy is going to be added. It's essentially your opportunity to get help to educate and guide you and your family members to make sure that you are seeing healthcare providers that are either within the plan pathways of the Sound plan, or you understand what your financial liability is, how the benefits work, is a prescription covered. All the questions that you can think to ask, I know we've answered a lot for employees already. The member advocate will be available from 5 a.m. to 5 p.m. Monday through Friday, so you can reach out to them. There'll also be a benefits app we'll be rolling out here before the plan goes live. That'll be super helpful with a lot of information on it. So as I mentioned before, we're rolling out this new medical program. So the medical plans through Aetna will be discontinued as of April 1st, and that includes the high deductible health plan. And so along with the high deductible health plans not being offered, Sound Family Medicine will no longer be offering a health savings account through Optum. So you're able to keep your health savings account and continue using that money, but you will be unable to contribute any additional pre-tax dollars after April 1st. The monthly administration cost of $375 that Sound Family Medicine has been paying on your behalf will now be deducted from your health savings account going forward. So you would pay that monthly administration fee. And then due to the high deductible health plan and health savings account going away, the limited purpose flexible spending account will no longer be offered. So you'll be able to submit for eligible reimbursements until the end of the grace period, but we won't be offering for any additional employees to participate in this program after April 1st. So we've talked a lot about the Sound plan, but you know, as healthcare costs have continued to rise over the last 15 or 20 years, it's gotten to a point where healthcare costs are essentially taking over wage increases and eating into household income. Many employees and people across the country have less than $1,000 in their bank account, yet have an out-of-pocket maximum on their health plan that exceeds what they have in savings. And so in order to address the rising costs of healthcare and ensure that Sound Family Medicine is able to offer an affordable program that is accessible to employees, we've chosen to create a community-owned health plan. And so essentially it's an approach where we're direct contracting with doctors in the area and connecting doctors and patients without the additional overhead and administrative costs that are typical in most medical plans. This approach ensures that you have access at simply a copay for many services without having to reach a deductible. And it ensures that the cost is lower and it keeps dollars within the local community versus going out elsewhere. So again, beginning April 1st, there will be 2 medical plan offerings for employees and their dependents. And as I mentioned, primary care, specialist care, physical therapy, chiropractic care, acupuncture, and mental health services will be accessible at only a copay, assuming that you're staying within the plan pathways of the medical program. So the Sound plan is a self-funded medical program. Essentially, we have selected a third-party administrator to administer this program. They're responsible for processing and paying claims, producing explanation of benefits, and providing the member advocacy that I mentioned previously. The third-party administrator is Hawaii Mainland Administrators, also called HMA. It's based in Phoenix, Arizona, and has a lot of experience in these types of arrangements. So once you receive your new medical ID card, you can register on the HMA portal. You'll be able to view deductibles that have been met, medical claims that have been processed or pending, and order a new medical ID card. So this is the Sound plan. It's the base program. And I'm not going to review all the details, but essentially there's two tiers, if you want to call them. There's within the plan pathways and then non-participating providers. As you can see, if an employee or dependent of this program that's participating stays within the plan pathway, there is a $0 deductible, and you're able to see primary care physicians, specialists, chiropractic, many services at simply a copay. There are many direct contracted physicians included in this pathway, as well as Sound Family Medicine included a significantly lower copay. As you can see, to see a primary care physician at Sound Family Medicine is only $5, whereas a primary care physician visit still within the plan pathways, but not at Sound Family Medicine is a $40 copay. And then non-participating providers, essentially deductible and co-insurance for visits outside of essentially preventative care visits as well as preventative medications. $75 copay for urgent care, regardless if a facility is contracted in the plan pathway or non-participating, and emergency room copay of $350 along with 20% co-insurance. And we'll review the pharmacy benefits in a little bit more detail, as well as what a plan pathway is. As well as included in the email that you're receiving is the SBC that again goes into more of the benefits in a little bit more detail. So we're also offering a buy-up plan with a $3,000 deductible. And again, staying within the plan pathways essentially eliminates the deductible and coinsurance, whereas going to a non-participating provider, there is a higher copay, as well as deductible and coinsurance for some services, such as lab testing, diagnostic imaging, diagnostic testing, as well as hospital and surgical procedures. So you may ask what a plan pathway is. So a plan pathway can be accessed by Sound Family Medicine participants of this program and their dependents in one of three ways. Either visiting a direct contracted physician or facility. We're in the midst of contracting with physicians and facilities now. We will send out an update every Friday, letting you know which physicians and facilities have been direct contracted. If for whatever reason you don't see your provider listed on the list we send out on Fridays, please request a provider nomination sheet from Kevin or Dona and submit that so that we can ensure to reach out to your provider and ask if they would like to be part of this program. For the first year, we've elected to access a couple additional networks in order to ensure that employees have access to providers within the plan pathway. So we're accessing a network called PNOAE, as well as the PHCS Provider and Ancillary Network. The PHCS Provider and Ancillary Network is a network, it's the largest rental network across the country. And so it also provides access should an employee be out of state or traveling within the United States. A couple key things to remember is the member advocacy piece. We know this program is different than what you've had in the past, and we want to ensure that you have access to get all of your questions answered. And so if you ever have questions as it pertains to the program, please reach out to the member advocate. They can answer your questions, they can reach out to providers, they can let you know how much a service is going to cost. They can do pretty much everything within the medical program, and they're absolutely amazing. Another key thing to remember is that prior authorization is required for several services. They're the same services that prior authorization was required of in the Aetna program. But if you fail to have a service pre-authorized and it is required, the service will be denied and will be the member responsibility. So it will not only be the member responsibility, but it will not go towards the deductible and coinsurance. So some of the examples of services that need to be pre-authorized are those such as CT scans, MRIs, surgeries, inpatient stays that are non-emergent or non-urgent. And so if you're unsure if your service has been pre-authorized, again, reach out to member advocacy and simply just ask them. One of the nice things about the member advocacy is if you reach out for a prior authorization, and let's just say you have to get a CAT scan and you're getting it pre-authorized at a facility that is not in the plan pathway, they may offer to share with you a few facilities or service providers, physicians, that are in the plan pathway, so that that deductible and coinsurance will be waived for you and for your medical services. So they're great advocates that take a super proactive approach to helping you and your family make the best healthcare decisions that you can for your pocketbook and for the Sound plan. So again, this is the member advocacy that I've mentioned throughout the presentation. If you have your cell phones handy, I would recommend putting the member advocacy phone number in on your phone, the 866-206-7920 phone number. The member advocacy department at HMA is also called Advanta. So don't let it fool you if you call and it says the Advanta team. Again, they're there to provide member support, help schedule services, ensure that prior authorizations have occurred, let you know what pricing looks like, and assist with a balanced bill should you get one. So again, please reach out to the member advocates as often as you'd like for services you're receiving on the medical program. So if you do receive a balance bill, so what is a balance bill to start with? So essentially, a balance bill occurs when you receive a medical service from a provider or a facility, and that physician or facility does not accept the plan's reimbursement as payment in full. If you are seeing a physician or facility within the plan pathway, there is no reason a balance bill should occur. But should you be seeing a non-participating provider, there is a potential for a balance bill. 99.9% of the time, there will not be a balance bill for a provider visit. Typically, balance bills happen when they are high-cost services, such as an emergency room visit, a surgery that potentially has anesthesiologists involved, an MRI, a CAT scan, things of that nature. And so if you receive a balance bill, please send it to the member advocate. You can send it to our team, the app, the benefits mobile app that we'll be rolling out. You can take a picture of it and submit it that way. If you are seeing a non-participating provider and you receive a balance bill, the member advocates will still do their best to negotiate that balance bill, but the member will be responsible for the balance bill should there be any additional dollars or balance remaining. If you receive a balance bill for an urgent care visit or an emergency room visit, not only will the member advocates negotiate that balance bill, but Sound Family Medicine will take on the responsibility of any balance bills for members that have urgent or emergent care. So if you are ever in a position you need to see an urgent care or an emergency, go to the emergency room. Please don't hesitate to go. We do not want to have any barriers as it pertains to emergent or urgent care. If you have any questions, I think I might have received a balance bill, not sure, just submit it to the member advocate team and they will confirm and let you know what the next steps look like. So the pharmacy benefits are going to be handled by a pharmacy benefit manager by the name of Drexy. Over 65,000 pharmacies across the country are included under the Drexy program. Once you receive your medical ID card, you can jump on Drexy.com and explore the member portal. You can see what medications are covered under the generic or brand name tiers. You can also see local pharmacies and you can compare costs. It's a really, really cool website that's really informational. So I'd highly recommend that you jump on and take a look. If you have questions as it pertains to the pharmacy coverage, you can reach out to Drexy directly. We have asked members that are on medications that required step therapy previously or are on specialty medications to reach out to us ahead of time so we can ensure a smooth transition. I want to let you know that for the members that have already reached out to us, as well as any members that haven't, and are on a prescription that, again, required step therapy, meaning you had to try 2 or 3 other prescriptions before you were granted an exception by the insurance carrier to keep the prescription that you have. For those prescriptions, when you go to the pharmacy the first time, they're going to reject, and you need to ask the pharmacy to call Drexy, just call the number on your ID card, and they will be approved on the spot. And so we weren't able to make that transition 100% smooth, but we can ensure that employees won't have to go through step therapy again to receive that medication. The other thing that we've asked is for anyone, again, on a specialty medication, please reach out to us as we work with an organization called OptiMed Health to source all of the specialty medications. It says cost shares will vary for specialty medications, but 99.9% of the time, those medications will be covered in full. So again, please reach out to us, reach out to the member advocates, and we'll make this transition as smooth as possible. Generic medications range between $10 and $15 for a copay, or $35 and $40 for a copay for brand name medication. If the cost of the medication is less than the copay, you will simply pay the cost. And then the mail order pharmacies, they have contracts with 3 different mail order programs PillPack through Amazon, Kroger, as well as Walmart. It will be the lowest cost by going through those 3 mail orders, but should you want to use a different mail order program, they can accept it. You just simply need to reach out to Drexy to ensure that that's completed. And again, it'll just be a 2-time copay for a 90-day supply. You also have the ability to pick up a 90-day supply at the retail pharmacy without completing mail order. So there's 2 different options there, which is great. So the dental program will continue to be offered through Guardian. There's a base and a buy-up dental plan. You can see that there's about a $25 difference in the deductibles between the 2 plans, and about $75 difference there for the max deductible for a family. 100% of preventative services are covered if you're in the dental network, Guardian's Dental Guard network, or if you're outside of the network. When you get into additional services where you'll see a little bit difference with regard to the levels that are covered as well as the annual maximum. The vision plan is a $10 copay and just through VSP. There's no card for VSP, but you simply use your social security number. This plan has been around for a while, and VSP is a provider that is used most commonly for vision insurance. Eyeglasses are just a $25 copay, and then contact lenses up to a $60 copay for the exam itself, and then able to get contact lenses every 12 months, just a $150 allowance. The flexible spending accounts, there are 2 different flexible spending accounts, healthcare FSA and then the dependent daycare FSA. So this is your ability to set aside pre-tax dollars to pay for qualified out-of-pocket healthcare and dependent care expenses. So on the healthcare FSA, you're able to contribute between $52 and $2,750 per year. This program is different than the health savings account in that you put money into the program. You can use it for eligible expenses. At the end of the year, though, you only can have essentially, it's use it or lose it. So there's a grace period to submit for claims, but the expenses for those claims, medical expenses, need to be submitted by June 15th and file for reimbursement by June 30th. So if you're unsure how much to put into your flexible spending account because it's use it or lose it, definitely reach out to us or Donna, and we can go through and share with you what potentially could be a good amount for you to put in on a pre-tax basis based on your expenses over the last year. This will be the account that will replace the health savings account in terms of the pre-tax savings. So if you know prescriptions cost you $100 a year, you can put in $100 in this account, knowing that you're going to use those expenses. And then the dependent daycare account is for you to, again, put away pre-tax dollars to pay for eligible dependent daycare expenses. So essentially eligible expenses for dependent children under the age of 13 or potentially for a disabled spouse or dependent. Includes after school care and many summer camps, although I know those aren't going on right now. You're able to contribute up to $5,000 per family or $2,500 if you're married and filing taxes separately. Neither of these accounts roll over, so definitely don't put in more than you anticipate spending because you won't get that money back. And that's not a Sound Family Medicine decision, that's an IRS decision, unfortunately. The IRS says if we're gonna allow you to put money into this account on a pre-tax basis, that the money does not roll over from year to year. And then one thing to note on the flexible spending account is that the healthcare flexible spending account, if you put in $1,000 for your annual election, you have that money available for you to use the first day of the plan year. So you put in $1,000 and on April 2nd, you have a $1,000 expense, you can submit for the full reimbursement. On the dependent daycare account, you can only submit for expenses based on what's in the account. So if you contribute $1,200 to the dependent daycare account, $100 comes out each month out of your paycheck. That's essentially how much you can submit for reimbursement on a monthly basis. So again, you can only take out of the account what you've already put into the account. You are not able to change these elections throughout the year, so definitely make sure to contribute an amount that you feel comfortable with. Unless you have a qualifying event is really the only reason you're able to make a change to these elections. Again, we're removing the limited purpose flexible spending account. So there's just going to be these two offerings this year, the healthcare as well as the dependent daycare account. And then life insurance. Sun Family Medicine provides life insurance at no cost to you. It's for all full-time employees and non-exempt employees. So there is a $10,000 and $20,000 benefit. Benefit reductions begin at age 65. So if you are enrolled in the plan and over the age of 65, it won't be quite that level of benefit. These benefits are provided through Cigna. And you also have the option to purchase additional life insurance. So you have the ability to purchase up to 5 times your basic annual earnings, up to a maximum of $500,000. Two things to note here is that if you apply for coverage when you're newly eligible, a new employee, then you have a guarantee issue amount of $100,000. If you want to apply for an additional amount over that $100,000, the evidence of insurability will be required, essentially a review of health history to ensure that the plan accepts the additional amount you want to elect. If you are an employee that's been with Sun Family Medicine for 5-10 years and you didn't elect voluntary life insurance in the past, you will have to go through evidence of insurability in order to apply for any coverage amount. So again, for new employees, always recommend to potentially just apply for the smallest amount so that you're able to increase that each year without the evidence of insurability. So for those employees that are on Cigna's voluntary life insurance, you have the ability to increase it. I want to say it's by 10,000, but we can confirm that if you're in that position. So you're able to increase it by an increment every single year without completing the evidence of insurability. And then Sun Family Medicine also offers long-term disability coverage to employees. And this essentially covers an employee in the event of a disability that goes past 90 days. So if you are disabled and unable to work past the 90-day mark, you're essentially able to submit to have 60% of your basic earnings covered. The other thing, and I apologize here, we were going to add language about Washington State's Paid Family Medical Leave Act. So Washington State offers the Paid Family Medical Leave Act in Washington. It is not offered through Sound Family Medicine, but should you have more of a short-term disability or have a new baby or be taking care of a family member, you could potentially be eligible for Washington State's Paid Family and Medical Leave Act. So these are the disability benefits. And again, if you have any questions, please feel free to reach out to Donna or Kevin or Adet Benefits, and we would be happy to answer any of your questions. Also provided through Cigna is Cigna Life Assistance Program, as well as Secure Travel. So essentially, if you're traveling and you need medical emergency assistance, you can call Cigna Secure Travel. It does not replace your medical insurance, but it will help you access care, help you with prescription replacement assistance, and provide medical referrals to you. It will also help in the event of emergency medical evacuation. The Cigna Life Assistance Plan essentially provides help in the event that it's like an EAP program. So if you're going through financial struggles, if you're potentially going through a divorce and need a little bit of help from a counselor, It provides up to 3 face-to-face sessions with a behavioral health counselor. If you're looking to get a will prepared, it can put you in touch with someone who can provide a will services for you. So these are great benefits should you need to use them. And if you're not sure how to access them, again, please reach out to Donna or myself at Adept Benefits, and we would be happy to assist you. The nationwide pet insurance is also available. It's a voluntary plan, but if you are looking to get pet insurance for your little ones at home, this is a nice offering that Sound Family Medicine has available. Oh, there's the Cigna Will Preparation Service. In addition to the Cigna Will Preparation Service, there's also the Identity Theft Program. If you're concerned that you've experienced identity theft, you can reach out and they can help you through the process, as well as college tuition benefit rewards. So if any of these services are of interest, we can provide additional documentation that reviews the services in more detail. So what is the cost for the medical program? I won't review all of these rates, but what I will tell you is that we try to keep employee and their family members' contributions as close to what they were previously. And so because we were moving from 3 plans to 2 plans, there is essentially either a 2% increase or a 2% decrease within that range with regards to the medical premium. So please reach out if you have any questions with regard to the medical premiums, but this information will also be included in the open enrollment materials that you receive. And then the cost of the dental and vision, the costs are not changing. They are the same as they were last year, but you do have the ability to move from the Guardian-based dental plan to the buy-up, or from the buy-up to the base. This is your annual opportunity to make changes. So the next step, essentially on Monday, open enrollment will open, and you can visit www.paycom and log in with your existing username and ID, make your benefit elections, and then submit. If you are having a difficult time logging in, you forgot your username or your password, please reach out to Donna. She would be happy to assist you. Please keep in mind that your current elections will not roll over. So it's very important to get online and complete your elections in the Paycom system. And then again, open enrollment opens on Monday and then ends on March 8th. So it's a little bit shorter window this year, but in order for us to ensure everyone has their medical ID card, we needed to have everything submitted by that second week in March. So obviously, this is a recorded video, so it's not a question and answer session. But what I will tell you is please reach out to us should you have any questions. We are absolutely here to help. Kevin and Donna are very accessible as well, and we want to make sure this is a smooth transition for you and your family members. So thank you so much for your time, and we hope you have a great day.